The risk of developing brain metastasis is not one size fits all for people who have breast cancer. We asked Dr. Kumthekar to tell us about who was at the highest risk of developing brain metastasis.
So when you take breast cancer as a whole, all stages, all grades, it's not a very frequent occurrence. However, because breast cancer occurs so much in the general population, when we do have something like stage 4 breast cancer, we can get brain metastases in anywhere from 20 to 40% of those patients. So for starters, patients with higher stage, so stage 4 metastatic breast cancer, are at highest risk. And then within that, there are certain biologic groups that are at higher risk. So those are patients such as those with HER2 positive breast cancer and patients with triple negative breast cancer. Also, there are some other risk factors that we've seen that can also kind of portend themselves to developing brain metastases a little easier. So again, we've already discussed the metastatic population, but also younger patients, African American patients. We sometimes see a higher incidence of breast cancer in these patients.
Dr. Kumthekar then explained how patients can proactively manage the risk of developing brain metastasis.
So the key in diagnosing brain metastases is being on the lookout for it. So as it stands right now, there's no screening standards for brain metastases, even in patients with some of those risk factors that we spoke about, like stage 4, metastatic disease, HER2 positive, triple negative. There really aren't screening parameters for that as of now. I think that that's also an evolving spectrum and hopefully an evolving science. So right now, it's really important, both as patients and doctors, to be open to that if those symptoms arise, or to make sure that we check for brain metastases should those symptoms arise. That being said, because there is a risk for brain metastases, what I would really encourage you to do is, if you have neurologic symptoms that arise, make sure you tell your doctor, make sure you tell your healthcare professional. They can help guide you through that, and if needed, order an MRI brain to make sure that you don't have brain metastases, or to see if you do, catch it ideally as early as possible so that you together as a team can do something about it.
For more information about brain metastasis, check out the resources from the American Brain Tumor Association that we linked below.